Number one, when the Office of the Surgeon General declares an issue to be a public health issue, not only does that put it squarely in the realm of public health, but it also elevates it on the priority scale. This is what we saw happen half a century ago with tobacco. When the first Surgeon General report was issued on that subject, it catalyzed a series of actions in communities, in schools, in lawmaking bodies all around the country that ultimately helped us reduce smoking rates from 42% in 1964 to less than 12% today. So it prioritizes the issue. But the other two things this advisory does is it lays out the impact of this issue, particularly on our kids. Many people may not be aware that this is now
the Surgeon General who's decided to do Democrats' bidding, and he's going to do gun control. They're not just going to do gun control, though. He wants to change law. Welcome back to the program. Dana Loesch here with you at the bottom of this second hour. Now, what I'm talking about specifically is this means to actually redefine and change what the law is on all of this. And that's where, this is from the New York Times that had, this is all organized. They all do this all at the same time. I'm pulling up this New York Times piece now. So the New York Times came out with something. They also had they had this piece where they said Surgeon General declares gun violence a public health crisis. He's calling for a multi-pronged effort to reduce gun deaths modeled on campaigns against smoking and traffic fatalities. That's not a new thing. The new thing, though, is this 32-page advisory. And that's what that's really kind of the crux of this, because he is politicizing it. He says that it's been politicized, but he's absolutely politicizing this. He says he thinks it's a public health issue. He claimed that the issue's been politicized and polarized. And but who has been doing the politicization of it? Because when you're not basing your advocacy on truth, when you're not basing it on publicly available fact, and you're promoting a false narrative in order to fearmonger people into an uninformed compliance, well, that is politicizing something, is it not? You're politicizing an issue and you're misrepresenting or omitting data entirely in order to get your preferred outcome. That is the absolute definition of politicizing this issue, if there is an official definition of it. And so his 32-page advisory, he's demanding an increase in funding firearm violence prevention research. Now, quick note on this. The left has always said that the CDC has been barred from studying anything on this. It's studying firearms, period. They're very careful in how they present their premise to you. They don't tell you exactly what it is that the CDC is prevented from doing. They just claim that the CDC is prevented from studying firearms. That's not true. What the CDC is prevented in doing by law is politicizing an issue. I don't want a government agency to try to manipulate data in order to prove a favorable outcome to me or an outcome that is hostile to me. Now, I say that as a logical person. This is why I should never be president, because I absolutely would abuse it. And I would totally cherry pick this data. Although the data supports me anyway, so I don't have to cherry pick anything. The point is that they're not banned from studying firearms. They're banned from promoting or either for or against. And that's what makes the left angry. They don't want just a simple study on firearms. And case in point, let's go back to this Forbes piece from 2018. And this is also one of the chapters in one of my previous books on guns. In 2013, the CDC, there was a study. They worked with the National Academies Institute of Medicine and the National Research Council, and they were studying firearms. In fact, it was a study about the use of firearms, and usually it was focusing on the offensive use. But actually what they determined is that the defensive use of guns by crime victims is a common occurrence. And in fact, this is where these famous numbers are further underscored. Gary Kleck, who's a Democrat criminologist who lives in Florida, is the guy who studied and came up with a number about 500,000 defensive uses annually. And the reason why it's an estimate is because not everything is reported and not every area reports crime similarly. And so as it relates to this study, the CDC actually they betrayed their own argument. They were trying to satiate the left and come up with a survey saying that oh goodness, this is the reality of the situation, is that defensive gun usage actually works and it is a common occurrence. Now, do you remember the story where this was from a couple of years ago. The CDC was colluding with gun control groups. And I was on Fox about this a couple of years ago. They were caught colluding with gun control groups and removing the numbers about defensive gun usage so that it didn't support the pro-Second Amendment side. That's an actual thing. California Rifle and Pistol Association had a deep dive on this because they ultimately got the receipts. They FOIA'd, actually. They had to use a Freedom of Information Act on it, and there are emails that show the CDC removed defensive gun use statistics after gun control advocates were upset that their numbers that were published and publicly available on the CDC website, after those numbers were shown to be detrimental to their gun control advocacy. And they are actual hard emails from a number of senators, a number of representatives. In fact, one of the, Mark Bryant, who is one of the gun control groups, said, quote, that 2.5 million number needs to be killed, buried, dug up, killed again, and buried again. Because it was harming their gun control advocacy. This, to my point, is what the CDC is prevented by law from doing. That is why our taxpayer dollars do not go to the CDC for them to create narratives to promote policy. That is not their job, either for or against. And there are tons of receipts showing that if they were allowed to do so, they would run with it because they've already been trying to do it. And there's publicly available emails that you can read that showcase it. I've written about it. Now, this in mind, do you honestly believe the Surgeon General when he says that this needs to be regulated like a public health issue? When they're lying to you about the numbers, do you honestly believe, do you want people who lie to you anyway? Do you want to give them power to further regulate what you can do? That's the $1 million question here. And he wants to change the law to do it. He's called for violence prevention research. To go back to this New York Times piece, he's advising health workers to discuss firearm storage with patients during routine medical visits. It's not their business. I don't go to the doctor and ask them medical questions, do I? Okay, so I don't need someone who is not in my home asking me questions about this, period. He also is recommending safe storage laws. He wants a national registry. And by the way, let's all do each other a favor. We're not using the phrase universal background checks anymore. We are not using the phrase universal background checks anymore because that's not what it is. It is a national registry. So I'm not saying that phrase anymore because we have background checks. Universal background checks require the establishment of a national registry in order to work. So let's call it what it is, a national registry. And that is exactly what Vivek Murthy is advocating for in his 32-page advisory. He wants an assault weapons ban, all kinds of stuff. Now, this isn't public health. This is politics. And he's not recommending anything. He's campaigning for it. This, all of these things that he's demanding, none of it actually contributes to reducing homicide. And this gets to my next point. He's saying that, well, it's children that are most affected. It's children that are at the greatest disadvantage of firearm violence. He has said this over and over again. I addressed it in one of the tweets that I had published and was reacting to on X a little bit earlier. And he says that it all has to do with kids. He says, what's devastating is how this has affected our kids. Firearm violence is now the leading cause of death. And he tries to cite CDC numbers for this. The same CDC that colluded with gun control groups to remove defensive gun uses, which, sidebar, if you're talking about offensive uses by career criminals as a premise to deny you a right, then isn't it also logical and fair that you should be able to cite defensive uses by innocent people against those career offenders that greatly outnumber those criminal uses? My case is made. To his point here about kids, and again, citing the CDC. Do you know how the CDC gets this number? There's been a lot written about it. They get this number because they include 18 to 19-year-olds in their definition of children. You all were 19 once. Do you consider yourself a child? You know why they do this. They do this to pad the numbers, number one. Because if you remove this, do you know that drownings and car accidents take first place? When you remove the inclusion of 18 and up from the CDC's numbers that average for children, then firearms, that's not the number one. It's drowning and car accidents. In fact, firearms drops precipitously. But they're trying to scare you into uninformed compliance. The whole point of this exercise is that they want to scare these suburban wine moms. They want to scare those women whose children are getting older and they need to find a cause. That's what they're trying to do. They want to scare them. They are trying to terrify them into uninformed compliance. And he vaguely blames firearms while he does it, while omitting the contribution of the repeat offender driving the crime, which is lazy and it's illiberal and it betrays a prejudice against the common firearm owner by comparing them to career criminals. This is the whole point. And then he includes suicides in his homicide number, and he writes it off as just gun violence with zero regard for mental health or even resolving the issue. And I'm supposed to believe that this guy has a genuine felt concern that is inspiring this advocacy in an election year? I'm to seriously consider that because I don't. And that's the problem. These people don't tell you that it's 18 and 19-year-old gang and drug-involved youth that are padding the number. They want to scare families. Their talking point disappears entirely when only children are included. And further, their overall homicides, padding by including a third of them suicides, that number drops also. So that's really, really, really malicious. Do you believe that these people care about your health? They're not even being honest with you. These are the same people who weren't honest with you, of course, about a number of things, including, the lockdown, the pandemic, the injections. You can't be surprised that they wouldn't be honest with you here. They had the Brady people, the Brady group out there saying, oh, yes, the Surgeon General, they say firearms should be treated like any other regulated consumer product. I actually thought that this was parody. Chris Brown, who's the president of the Brady Group, said, imagine if we treated guns as lethal objects, including ensuring they're kept out of the reach of children. What? I said I thought it was parody, and it's not. Her reaction is based entirely on demonstrably fraudulent numbers that are being pushed to propagandize ahead of an election. That's not advocacy. That is politicization. What they say that they're against, but they're doing. And that she has no idea, by the way, on how the average family approaches firearm safety demonstrates that Chris Brown needs a couple of safety classes herself.